Autism spectrum disorder is not all that uncommon. More than 3.5 million Americans live with this disorder. In fact, it's very likely that you know someone who has ASD. It occurs in all racial, ethnic, and socioeconomic groups, is 4.5 times more likely to occur in boys, can be detected as early as 18 months and diagnosed by 2. And although early intervention is key to improving outcomes, most children aren't diagnosed until 4 years of age. Hi, my name is Kurat, and welcome to the second in a series of short modules on autism spectrum disorder for parents and providers. In our first video, we identified some of the typical milestones to look for as a young child develops. In this module, we're going to learn more about autism itself and how it's diagnosed. To begin, autism spectrum disorder is a developmental disability that can result in significant social, communication, and behavioral challenges. In terms of a diagnosis, a person with ASD needs to show persistent deficit, a problem or concern that continues in 2 areas. The first, social communication and social interaction, and the second, restricted and repetitive patterns of behavior. Okay, so what do all of these criteria mean anyway? And how does it correlate to a diagnosis of autism? According to Clinician Guide, the Diagnostic and Statistical Manual of Mental Disorders, version 5, a person with autism spectrum disorder must have the following deficits in the past or in the present. Deficits in social-emotional reciprocity. This relates specifically to the challenge in developing relationships with others that mutually benefit each person. This deficit also applies to difficulties in developing, maintaining, and understanding relationships. Another criterion is a deficit in nonverbal communicative behaviors used for social interaction. In addition, a person with ASD must show at least 2 types of repetitive patterns of behavior, including repetitive motor patterns, like arm flapping for instance, as well as echolalia, which is the repetition of words. Other repetitive patterns include the insistence on sameness, or becoming rigid when a routine changes, fixated interest or an unusual interest in sensory aspects of the environment. A good example might be a twirling ceiling fan or rolling credits at the end of a movie, as well as hyperreactivity to sensory input. This could present itself as a no reaction or overreaction, such as a tantrum to pain, heat, and cold. So, knowing all this, what does the American Academy of Pediatrics recommend in terms of screening? It starts with developmental surveillance, or monitoring a child's developmental milestones and progress at every well-child visit. Listen, look, think about the risk, and talk to parents about their concerns. Remember, most parents will tell you about any concerns early on. Developmental screening should occur at 9, 18, and 24 to 30 months, and ASD-specific screenings at 18 and 24 to 30 months. An extensive list of available developmental screening tools can be found in the journal Pediatrics. Some of the tools you'll come across include the Ages and Stages questionnaire and the Parent's Evaluation and Developmental Status. Another terrific screening resource is Birth to 5, Watch Me Thrive. It's a federal initiative designed to promote developmental screening and is loaded with helpful resources for primary care providers and other early childhood providers, including a compendium of screening measures for young children and a primary care provider guide. Screening tools created specifically for ASD are also available and are used at 18 and 24 to 30-month well-child visits, including the Modified Checklist for Autism in Toddlers with Follow-Up Interview, MCHAT for short, and the Infant Toddler Checklist, ITC. Both of the resources are free to download, print, and score, and are listed under CPT code 96110. For more information on developmental screening tools, visit the New York State Department of Health websites on your screen. There is no doubt that recommended early intervention has a tremendously positive impact on young children with autism. So much so that in some cases, a child will no longer meet the criteria for the diagnosis. Take care, and thanks for watching.